Hello, my name is Jenny Basket, and I'm presenting on reactive attachment disorder. The DSM-5 classifies reactive attachment disorder as a trauma and stress-based condition that is caused by neglect and abuse. Reactive attachment is caused by abuse and neglect. It can also be caused by not being able to attach or a broken attachment because of removal from the home. Some other considerations to kind of keep in mind would be like a mom with postpartum depression that can't take care of her child, babies with colic or hernias or strep throat, prolonged ear infections. The characteristics you're going to see with children with reactive attachment disorder is you're going to see them not having any coping skills, not being able to regulate their emotions. They didn't grow up in places where they were taught these things. They didn't see these things. And so you're going to see like excessive reactions, like big temper tantrums and inappropriate affection towards teachers or strangers, but none towards the parents. Failure to show emotions of conscience. There's potential for displays of cruel behavior to other children and pets. A lot of times these children have done whatever they needed to do to survive. So you might see some instances where this child is like bright and sunny and charming, and then you look at their parents or their caregivers and they're frustrated and angry and exhausted. You might see like obvious lying, things I'm watching you. I just saw you do that. No, I didn't. Stealing. They have a lot of trouble with like impulse control, and there can be like learning disabilities, and there are also attempts at like triangulation and manipulation and like false allegations of abuse, because this is how they've learned to survive. If that's, starting fights between adults to get their attention away from the child, they'll do it. If that's eating out of the trash can, they'll do it. Attachment disorders are a very new category of potential diagnoses, so there's not a lot of information about them yet. What they do know is that counseling for everyone is really important. Parenting skills classes, occupational therapy, support groups, education for a lot of people, like friends and family members that the child encounters, so that everybody's on the same page and they know what to look for with these symptoms and these characteristics, and they understand that the child is just getting their needs met however they can. All of the trauma that causes reactive attachment disorder has a huge impact on their development. Anxiety, depression, hyperactivity, reduced frustration tolerance, excessive reactions, and non threatening situations. There's not really any clear indicators of which children are going to develop reactive attachment disorders. So, right now, the prognosis is either with or without help. Either way, they're either going to grow out of it, have healthy attachments, or they're going to struggle because of the trauma and all the other risk factors that they have. For a child with reactive attachment disorder and working with occupational therapy, the most important takeaway is that we work with their family, we work with the child, we work with everyone together, and to make sure that we're promoting a sense of peace and security, and that we have goals, and that we are caring and nurturing and supporting everyone. Precautions when working with children with reactive attachment disorder is to limit their exposure to multiple caregivers within the OTA OT realm. We want to keep it as consistent as possible. And you also want to avoid the use of physical restraints or forced bonding. I know that as OTs, we're not going to do that, but there are some people that are advocating for that method. And I think this slide speaks for itself in the impact that treatment can make in somebody's life. Thank you for your time, and you all have a great day.